The way of learning. Today's topic is thalassemia and aplastic anemia, exhibited for staff nurse entrance. Thalassemia. First question is, the nurse should instruct a patient who has diagnosis of folic acid deficiency anemia to increase intake of which of the following foods? Option A, dairy products. Option B, green leafy vegetables. Option C, citrus juices. Option D, fish and poultry. Correct answer is option B, green leafy vegetables. Next one is, a client has been diagnosed with pernicious anemia. In planning care for the client, a nurse anticipates that the client will be treated with option A, thiamine. Option B, iron. Option C, vitamin B12. Option D, folic acid. Correct answer is option C, vitamin B12. Next one is, which finding is persistent with pernicious anemia? Option A, strawberry tongue. Option B, rice water stool. Option C, beefy red tongue. Option D, hypochromic RBC. Correct answer is option C, beefy red tongue. Next one is, in a patient with pernicious anemia, primary purpose of ceiling test is to determine option A, intake of vitamin B12. Option B, absorption of vitamin B12. Option C, excretion of vitamin B12. Option D, none of the above. Correct answer is option B, absorption of vitamin B12. Next one is, ceiling test is used for detection of option A, folic acid deficiency. Option B, cyanocobalamin deficiency. Option C, iron deficiency. Option D, iodine deficiency. Correct answer is option B, cyanocobalamin deficiency. Next one is, what care would nurse provides for patient undergoing ceiling test for pernicious anemia? Option A, provide bed rest. Option B, monitor vital signs. Option C, collect 24 hours urine specimen. Option D, maintain preserved dressing. Correct answer is option C, collect 24 hours urine specimen. Next one is, the nurse is preparing a patient for a ceiling test. Which of the following is most important for patient to know before starting the test? Option A, how the result will be interpreted. Option B, how to collect a 24-hour urine specimen. Option C, why radioactivity is used. Option D, how vitamin B12 is measured. Correct answer is option B, how to collect a 24-hour urine specimen. Aplastic anemia. First question is, the condition directly related to bone marrow suppression is option A, anemia. Option B, sickle cell anemia. Option C, aplastic anemia. Option D, megaloblastic anemia. Correct answer is option C, aplastic anemia. Next question is, definitive diagnosis of aplastic anemia in children. Option A, decreased hemoglobin. Option B, decreased level of hematocrit. Option C, increased size of RBC. Option D, bone marrow aspiration. Correct answer is option D, bone marrow aspiration. Next one is, an acute condition characterized by production and increased diminished destruction of RBC triggered by viral infection or folic acid deficiency is option A, adrenal crisis. Option B, aplastic crisis. Option C, vaso-occlusive crisis. Option D, splenic crisis. Correct answer is option B, aplastic crisis. Next one is, Karan has been diagnosed with aplastic anemia. The nurse monitors for changes in which of the following physiological function? Option A, bowel function. Option B, peripheral sensation. Option C, bleeding tendencies. Option D, intake and output. Correct answer is option C, bleeding tendencies. Next question is, aplastic anemia is characterized by one of the following. Option A, reduced production of red blood cells. Option B, reduced production of white blood cells. Option C, reduced white blood cells and platelets. Option D, reduced RBC, WBC and platelets. Correct answer is option D, reduced RBC, WBC and platelets. Next one is, decreased number of erythrocytes, leukocytes and platelets are indicative of what condition? Option A, pernicious. Option B, aplastic anemia. Option C, sickle cell anemia. Option D, polycythemia. Correct answer is option B, aplastic anemia. Thanks for watching. Like, comment and subscribe the channel.